All right, we're almost at 3 o'clock. In fact, now it is exactly 3 o'clock according to my computer. So welcome everybody here today for today's meeting and webinar on the insights into Moxa and Mugwort with new research. So thank you for joining us. My name is John Stan, for those of you that don't know me, and I'll be your host today. And before we begin, I want to just ask those of you here in attendance to mute your mics until we get to the question and answer portion of this meeting. I've been very much looking forward to today's session with our two guests. As you all know, Moxibustion is one of the 5 pillars of TCM, and the more we know about it, the more we can optimize the use of it in the clinic with our patients. I would like to introduce you to today's guests, speakers and presenters. First, we have Oran Kivity. Oran has trained in Europe, China, and Japan. He ran a busy London practice from 1987 to 2004. And in 2000, he was the founder member of the Toyohari UK and the British branch of the Toyohari Association of Japan. He lectured in acupuncture at the University of Westminster in London from 1994 to 2004, and he was a teaching assistant for Stephen Birch, one of the foremost authorities on acupuncture, both in Europe, South Asia, and Southeast Asia. Oran's workshops are lively and informative with a focus on hands-on practice. In 2005, Oran made a big move and moved to Malaysia, and then in 2020 to Taiwan, where he practices and writes. He's passionate about Japanese acupuncture, and he continues to teach internationally. And we welcome here to today's event. He's the author of Moxa in Motion on the Ontake method, and he's also generated a number of tools on that process that are available. So welcome, Oran. We also have Merlin Young. Merlin Young is a UK-based acupuncturist specializing in Japanese acupuncture Moxibustion. I guess you guys must have known each other for a long, long time. As a committed advocate for healthcare equity, he co-founded Moxafrica charity with Dr. Jenny Craig in 2008, exploring Moxa's potential to treat the drug-resistant TB, and in particularly in HIV-affected regions of Africa. Moxa Africa's work has resulted in 3 random controlled trials and 2 peer-reviewed publications. Merlin is the author of The Moon Over Matsushima, which was first published in 2012. And that book represents a comprehensive examination of Moxibustion and its age-old relationship with acupuncture. And so it has in-depth research that reveals mugwort's biochemical properties, and it discusses a variety of traditional treatment approaches and proposed modern applications for the use of Moxibustion in the clinic. And last month, Merlin released a second edition that is thoroughly revised and expanded. And in this new edition, Merlin builds on his earlier foundations with extensive new research that hopefully we'll hear a little bit about today, which has brought the use of Moxa into primary care in the fight against drug-resistant tuberculosis, which is a critical global health crisis. So due to all that extra material, he created a whole new section of his book, and he presents further information on pharmaceutical research that could transform our understanding and practice of Moxibustion today. So welcome, Merlin. For your reference, for those of you that weren't here when you heard, Merlin is in the UK, and it's 11 p.m. his time now, and Oran is in Taiwan, and it's just 7 a.m. for him. And we thank you both, gentlemen, for taking the time with us at these odd hours to share your passion and clinical insights with us today. So we have 1 hour scheduled for today's discussion. First, we'll start with Merlin, who will share his journey with Moxa and new findings and implications of these findings. And then Oran and Merlin will discuss current topics on Moxibustion. Does that sound okay, you two?
Do you want to dive in first, Oran, briefly?
Uh,
Yeah. So,
Okay.
hi everyone.
Okay,
Good
just a
afternoon.
second. So just before you start, Oren, then we'll switch it up then. About 15 minutes
No, no. I
before.
was just going to comment on what you were going to say. So, Merlin is going to present a PowerPoint, and
Okay,
then probably we can do it like short discussion afterwards, and then I'll also present a PowerPoint about Moxa and kind of different aspects of Moxa. So,
sure.
and then we can all talk. So it'll
Yeah.
be
So I was
yeah.
thinking
So
that,
so
so I was thinking 15 minutes before the end of the hour,
mm,
we'll open the questions up and please type in your questions into the chat just so that we don't have people talking over each other. And then I will then ask the questions out and then Merlin and Oren can be free to share their answers. Okay, how does that sound?
Yes, it sounds good.
Okay,
sounds
great.
great.
Well, I'll let you take over then.
Okay, so if I'm going to share a screen. Okay, so what I want to talk about is really pretty exclusively some of the new scientific data that, or the scientific research more accurately, that's been evolving over probably the last 10, 15 years, some of which could be extremely relevant to what we do with Moxa. Um, and so the little acronym or whatever that we're going to familiarize ourselves with in the next quarter of an hour, what we call TRPs, and particularly want to discuss exactly how Moxa may interact, or rather they may interact with the way we use Moxa. So first of all, I just want to go back in time a little bit, and I want to discuss how Moxa was used, particularly my angle on it, I think. Basically, for me, Moxa is older than acupuncture, and I think that's pretty indisputable. But I also think it was it was undervalued right from the start of acupuncture. As acupuncture emerged as a systematic therapy in its own right, using needles, which I'm pretty sure evolved from the use of Moxa over many centuries before that. And as it emerged, I'm pretty sure that the original acupuncture physicians, I'd say deliberately covered their tracks from where they got it from. But despite that, and so in the original, the seminal text, the Suen, the Neijing, the two Neijing texts, Moxa is it's mentioned, but it's not mentioned to any great degree. What's really revealing is it's not mentioned once in the Nanjing. And I mean, the Nanjing is a wonderful text, but it just does not refer to Moxa. And for me, that's a bit of a smoking gun, really. But despite that, through the centuries, really, certain strengths regarding Moxa have been preserved and survived. And there's three real strengths. One was for last resort treatment, and these will be multiple Moxa treatments for imminent death, basically collapsed yang or something similar. And obviously, those treatments are pretty much covered these days in accident and emergency departments. So we don't really come face to face with them, although it's always worth bearing them in mind. The second one is for longevity, which certainly came in probably from the 6th century. Before that, I'm not sure, I'm not so sure. But there's been some very famous Moxa specialists who have lived for over 100 years. So it's an interesting phenomenon. And I think that what I'm going to try and suggest is that the 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 interaction between the Moxa therapy itself and these TRPs may help explain why that is, and also for treating intractable disease. Um, and intractable disease is where modern medicine really struggles. So that's a specific and very particular interest, I think it should be for us. And just as a little PS in that, since at least the 7th century, intractable disease in the literature included tuberculosis, which has been something of specific interest for me. And there's a little quote here, which comes from Ling Shu 73, which kind of supports what I'm saying, which is that Moxa can be effective when needling basically isn't and it's explicit in there. It doesn't tell you how to use the Moxa, which it does about the needle, but it does tell you plainly that it can be effective when needling isn't, which is something we should bear in mind. I'm just including here a couple of my favorite quotes about Moxa in the early centuries. One is from Wang Tao, which is acupuncture can kill living people but cannot revive the dying. So two little secrets there. One is that acupuncture wasn't safe for obvious reasons when the idea of cross infection wasn't exactly on anybody's mind. But it cannot revive the dying, therefore I only adopt Moxa. So there we've got an explicit idea of it being used as last resort. And the other one was from Dokai, about the same time actually. Dokai as far as I know, is primarily a herbalist. Didn't use much acupuncture, but was a big enthusiast about Moxa. And for him, Moxibustion with a doctor not using Moxa is like a cook who's using fuel to create his dishes. And in a culture like China, which is so focused on its culinary arts, I think that's quite significant. So what are these TRPs? So first of all, let's spell them out. Transient receptor potential ion channels, and it may be that, well, one or two of you may have heard of them. They're certainly not in the sort of the popular scientific literature, as far as I can see, as yet, though I'm certain that they will be. Part of the reason may be because they're quite hard to explain, which is where my challenge lies in the next quarter of an hour. So, but the second thing is obviously what's Moxa got to do with it. So I can bang on about TRPs, but ultimately I want to tie in what I think, how they tie in with Moxa, and exactly how potentially exciting that is for us as therapists. So here, unfortunately, I've got a thing that's blocking it in the corner. Don't know whether I can move it. Yeah, I can. So here we've got a simple representation of a TRP, and if I can bring up
We don't see anything in the corner there.
down the bottom corner.
The top right corner is a black box.
Yeah, no, but bottom right, that's what I need. But I just need my pointer. Just bear with me, and I can bring it in. Okay, so this area here, bottom right hand corner, and what we've got is this is a cell wall. It's very simplified. This very simplified. This is a cell wall, and what you have is these little things here are the TRPs, and the one this is the outside of the cell. And this is the inside of a cell. Now, actually, what you'd have is a circular cell, and you'd have loads of these little things, varying depending on the cell. But what this basically explains the fundamental principles. The one on the left here, you can see it's squeezed shut. So this is a TRP which is expressed on the surface of the cell. In other words, it's there, but it is closed. So it's dormant in every sense. It's dormant. The one on the right is one that's been opened, and it's been opened by an agonist being something which activates it, stimulates it to open, and when it opens, as you can see, there's a gap in the middle, and this is simplified, but when it's opened, positively charged particles, ions of mainly calcium, pass through inside the cell to activate it, and from there on there's a sort of cascade effect. So the basic idea of them is they're dormant until they're stimulated or activated in some way, at which moment they will open temporarily the transient receptor potential. So they have the potential to open, and they should be transient. If they're working functionally, they should be transiently opened. So what do TRPs do? Well, they act a little bit like valves, open or closed. When closed, the cell remains in a stable or quiet state. When opened by an agonist, as I said, they allow cations, that's positively charged, basically positively charged atoms actually, to pass through to excite the inside of the cell, provoking downstream sensations of heat or pain to occur in the brain. And this is a quote from a scientific journal, so it formalizes it. TRP channels cause those are calcium positively charged ions influx in response to various stimuli, which cause a brief rise in intracellular calcium, as well as a swift modification of the calcium signaling pathways. So it sounds a bit technical, but don't worry too much about it. The next slide is basically just to try and summarize a little bit about the background of these things. So there are 28 different TRPs so far that have been found. The first one was found back in the day in fruit flies. In mammals, there's 28 of them. They exist in 6 subfamilies. This is not so important, but I just wanted to get this out and clear. They occur on the surface of all sorts of cells. We're looking primarily at sensory cells beneath the skin for Moxa, but they actually exist in all sorts of cells, and this is where it gets potentially very interesting indeed. Skin, lungs, brain is very important. Kidney, heart, immune cells, etc. There are subfamilies on them, but there are 3 particular TRPs which we're going to focus on, and this is these 3 here, TRPV1, TRP, but I'll talk about them a little bit more, and don't worry about them for now. And they're frequently co-expressed on the surface of nerve cells. And it's this particular aspect of them which is particularly interesting for them in response to Moxa. Chronic dysfunction, it's the dysfunction of these TRPs which is so important, because when they become dysfunctional, all sorts of things happen, including in certain circumstances, chronic pain disorders. So if they're acting functional, everything's okay. So I just want to introduce in a bit more detail these 3 star TRPs, I'm going to call them. So our first one, TRPV1, I'm going to call him Senor Chili, because he's activated by capsicum, which is in chili oil. But in particular for us, TRPV1 is sensitive to temperatures between 43 to 52 degrees C. Now that's a temperature which feels hot, unpleasantly hot, because it's a temperature at which that threshold of 43 is where cells start to die. But at 52, actually another TRPV activates, and that's when you're going to get first-degree burns. So it's a critical temperature for us to basically avoid, to make movement to avoid. And this TRPV1, which is very, very much the star of the show, is sensitive to this specific temperature, and it's this temperature which is likely to be breached by Moxa if it's burned close to the skin. It's going to be raising the subcutaneous area by above 43. And it can be desensitized by chili oil, capsicum. That's the important thing I want to stress at this point. So it can be activated, so the brain sort of kind of records, we've got heat here, we need to move. But by the same token, it can be desensitized, and that can be very important for us, potentially with Moxa, in regards if it's being activated because of a pain situation. And the second one, I'm going to call him Wasabi-san, because it's a TRP which is specifically sensitive to wasabi. Wasabi obviously is it can be quite an unpleasant sensation, but to put it in perspective, TRPA1 is actually injected by the black rock scorpion to actually paralyze and kill its prey. So it's a very nasty thing indeed. But it's inhibited by 2 chemicals, which are identified at the bottom there, borneol and cineol. When activated, it provokes profound pain, and obviously when it's inhibited, much less pain. And it's inhibited by borneol and cineol, which we'll come back to shortly. The third one I'm calling Mr. Minty is TRPM8, and it's also sensitive to borneol, but in this case, it's activated by borneol. So you see there, wasabi is inhibited by borneol. Mr. Minty, TRPM8, is actually activated by borneol, and when it's activated, it actually provokes a pleasant cooling sensation. So Some TRPs are thermosensitive. In other words, they activate at different temperatures, but they're also individually sensitive to very specific chemicals. And if you can just get your head around that, a lot of this will become clearer. Some are activated by a specific chemical and some are inhibited, which I've just touched on there with TRPA1, wasabi and Mr. Minty. But our 3-star TRPs are frequently co-expressed on the same cell wall, which is a very curious coincidence for us. They activate at different temperatures, but all three are potentially separately affected by Moxibustion by Mugwort. So this is just to explain it a little bit more. You've got these three, the TRPV1, TRPA1, and TRPM8. So TRPV1, it's basically triggered by a temperature above 40, it should be 43 actually there, but between 43 and 52, but it can be desensitized by capsicum and by scattered moxa. TRPA1, it's natural, it has several agonists, that's the ones that activate it, but the antagonists, the ones that actually suppress or inhibit it, are actually remarkably rare in nature. And there are only two. One is 1,8-cineol and the other is borneol. And the curious thing is, 1,8-cineol and borneol are the two most dominant chemicals in mugwort, which is kind of like, what? Can that possibly be true? There are 192 chemicals that have been recorded in mugwort, and the two most dominant ones have this capacity to inhibit the activation of TRPA1. And then TRPM8, its natural agonist is menthol, but also borneol. So in this one, it can suppress the it can activate this cooling sensation. So if we remember how traditionally moxa was used for intractable disease. Now, obviously, back in the day, 2,000 years ago, what was intractable disease? It's probably very different to what they are today. But nevertheless, I'm sure they have certain similarities. And the reason why I'm going to suggest that is because I'm pretty sure that intractable disease, whether 2,000 years ago or today, were all involved with TRP dysfunction. So here's a list of the chronic conditions that big pharma research already suggests are at least associated with TRP dysfunctionality. And if you just cast your eye down that list, it's pretty significant by anybody's standards. And the last one of all is our own RCT evidence with TB, which we've got. I mean, that we've got clinical evidence that moxa does have an effect on recovery from TB. But we've got cancer, we've got the big neurological disorders of our age in there, hypertension. This is potentially enormous if it can be better explored or better exposed. So I just want to go back very briefly to those traditional strengths of moxa: longevity and treating intractable disease. And it seems to be almost a certainty that the reason that moxa with mugwort itself became, because there were other combustibles that were used originally, but the reason it became favored almost certainly seems to be anyway that the use of the heat from the actual moxibustion itself, but the potential absorption at least of chemicals through the skin, these dominant chemicals in mugwort, played a really complex and highly variable, obviously must be highly variable effect on the body, some of which has systemic effects. And obviously that's probably dependent on point location and also on technique and how it could be modified. So do TRPs explain why moxa was so much accepted in the past? And I'd say yes, it does. But it also explains why mugwort became the favored combustible. But more importantly of all, from my perspective at least, is whether we can improve our understanding of these TRPs that will help inform us better how we can use and particularly refine and adapt the way we use Moxa today. And to put that in perspective, there is an awful lot. And the reason I know anything about this at all is only because I can find research on it on the internet. It's open source. It's been widely researched. There's loads of papers being published on it. But but and they've been funded by big pharma, and they don't do anything for free. So big pharma have been funding this research because they are pretty convinced that there are some big blockbuster drugs that can be developed behind this research. It's going to be very difficult for them to do it because it involves getting drugs into the body, into places which are very, very, very sensitive to medication with probably very complicated side effects. So, but these are for the big diseases of our age. So the beauty for us is we're working from the outside in, and if we know that, well, we can pretty much assume. I'm going to know is too strong. We can pretty much assume that Moxa has some effect. If it has effect through these TRPs, it is having some effect from the outside in. So it's just a question of how we can find ways to modify our approaches, adapt our approaches, invent new approaches, which exploit these particular dynamics to help us to maybe try and make our own inroads into these intractable diseases of our age. So on that note, thanks for listening to my little bit. And there's a lot more information on, obviously, on the TRPs. There's 40 to 50 pages of it in the second edition, almost none of which was in the first edition. So there's quite a lot in there if you want to read any more about it in respect of this kind of thinking. There's plenty of research on the internet if you want to go looking for it, and most of it is open source, which is wonderful. And if you are interested in Moxafrica's own RCT evidence in respect of TB and particularly MDR-TB, then please have a look at Moxafrica's website.
Amazing.
So, yeah.
Amazing. There's a lot of questions, but I'm going to hold back like everybody else in the audience and wait till we have our time. I'm going to hand the floor over now to Oran. If you could stop sharing your PowerPoint there, Merlin.
Where do I get? Yeah, where do I find it to stop share?
I think I can
Be
do
at the top.
Yeah. Stop share. I got it.
There we go. All right.
Oh, that was great, Merlin. That was great. I love the little characters, Mr. Minty and Wasabi-san. That was
Señor
great.
Chili.
Yeah.
Yeah, I could have done part of it with kind of Mexican accent or something, but I thought I'm going to push me luck if I try that.
Definitely, especially as you're broadcasting to North America. All right. Yeah. Okay. So I wonder, before I go into that, I think, John, I would invite a couple of questions because when it's fresh in people's mind, because otherwise kind of people will get distracted with what I'm going to
Sure.
talk about.
Okay.
So
So I will so one of the first questions that popped up was from Jacqueline. No, it was sort of just got popped up here. So somebody was asking whether it was the TRPs are similar to a stoma in a plant cell. Are you familiar with that, Merlin?
No.
I'm not
No,
sure what a stoma is.
I'm afraid to say that I'm going to duck that straight away. I don't know. I
Sorry,
don't
we
know.
can't answer that one.
Yeah.
And would these TRPs be involved in people with diseases with fibromyalgia? Was a question from Tammy,
Well,
from Jacqueline.
actually, that's a great question from my perspective because the truth of the matter is that most of what I'm saying is largely hypothetical or theoretical, but I've done some a kind of a small protocol adventure with some fibromyalgia patients, and actually have got what I consider to be pretty good results with it, using some of the principles of points which are either hypersensitive or thermohyposensitive, um, discriminating between them and then actually focusing on the hyposensitive to try and basically balance out the dysfunction in an area, specifically in the case of fibromyalgia in the intrascapular area in the
Hmm.
upper back. Um, and fibromyalgia is my best example actually to date
Okay,
of
great.
actually an adaptation, a kind of like, well, let's think this through, let's try and figure this out. Let's try and develop a treatment model, put it to the test and see what happens.
Hmm.
So that's almost like my first, yeah, the first port of call sort of thing.
So,
Yeah.
so thank you for that. Sandra has asked a question that was actually on my mind, and that was with the use of these new heat lamps or heat bulbs
Mm.
that are therapeutic in the effect that they produce the same wavelength
Yeah.
that
Yeah.
Moxa heat produces on the ember. So there's the indirect Moxa,
Mm.
and then the oils and things that you were reflecting in your talk would have only be present if you put the Moxa on the skin
Mm.
and burned it, like as in the Japanese type of Moxibustion, where you have the pin, the through grain Moxa treatment. Would that be correct?
Yeah. I
So
mean,
would you be able
yeah.
to solve that by using a Moxa essence of some sort and then putting that down and then heating it with an external heat source? I know I'm
Yeah.
just kind of
Well,
following through.
the truth of the matter is I don't know, but what I think we can be very confident of is that there are multiple mechanisms in Moxa, and this is only one of them. So there was some very good research from Shanghai years ago about the wavelength, the far infrared wavelength, the profile of it, the spectral profile, I think you call it.
Right.
And I think that's probably what the lamp is trying to
Mhm.
resolve. Would that be stimulating TRPs? I would I would say if depending on the heat, it would certainly stimulate the one of them, the TRPV1, Senor
Right.
Chili. But the other two, you've got to get the oils onto the skin.
Mm.
And to that, you'd have to use
Mm.
some form of direct moxa. So you're trying to get the balance between the oils and the heat if you want to exploit these three
Mm.
TRPVs. If you're using indirect moxa, that's off the skin, I honestly think you'll be hard pushed to get
Mhm.
much absorption, if at all. But you could from the smoke, theoretically at least, you could from the smoke, because the smoke will be carrying the same chemicals.
Mhm.
Um,
Right.
but but I've got to sound vague on that because I am a bit vague in all honesty. And my specific interest is in small cone direct moxa. And
Right.
I know that also small cone direct moxa has effects on the autonomic nervous system, which have effect on the immune system. So there's another mechanism there.
Mhm.
But if we're talking about the TRPs, I think, yeah. And when it comes to the essences, to be honest, I don't know what's in them. I really
Right.
don't.
And
There are
that and
more
that
the creams.
actually just when you think about some of the different types of moxa on there, someone was asking about pure moxa and like smokeless moxa. And then there's the souk moxa that comes from Korea.
Mm,
And I guess, if the tradition has been to use mugwort as the choice plant, then it must be that there must be some component of the Borneo and cineol that you were talking about there.
yeah, and particularly for the intractable disease and the longevity, these aspects, I think.
Mhm.
Yeah.
And then Ted Van Hermit. Hi, Ted. How are you? He said that mint has borneol in it, and so is mint not activating some of these TRPs
Yes.
also?
Yes. Yes. Because mint is Mr. Minty. So mint has borneol, absolutely correct. But so does mugwort have borneol. So it's actually often called the menthol
Right.
TRPA1, that
And
one.
that's what Ted
The
was
menthol
saying.
one. So yeah, that's actually confirming it. Yeah.
All right. Well, Oren, would you like to take over a little bit and then we'll go back to some questions and answers afterwards?
Yeah, sounds great. Okay, so let me share a screen. And I'm going to talk about a difficult question that comes up, which is that we should we or should we not use Moxa in hot conditions? And this is something that Merlin and I have discussed at length, and something that there's a disagreement or a misunderstanding between the concepts of TCM and the concepts of Japanese Moxibustion. So I'd like to talk briefly about this and give you some examples of Moxibustion, basically unlocking the heat with Moxibustion. So I'm going to try and reframe some of our thinking about Moxibustion. The first thing is that we all know from our kind of basic first years that yang creates yin. So heat and yang create yin. So there's a philosophical implication that Moxa can be used to create yin. And I won't say too much about that because I'm going to come very much from a pragmatic point of view. And I think we can come back to that in the light of, Merlin's discussion. So, I mean, my Moxa pathway is very simple. I started off using a Moxa pole like most people. And later on, I got into Japanese Moxibustion and rice grain Moxibustion and cone Moxa, large cone Moxa, and then using Moxa on the end of the needle. And I found it all very effective. And then later on, I got into using Ontake warm bamboo, which is kind of what I'm well known for. And one of the things that I think we all know about Moxa is that patients like it. It feels really relaxing for the most part. I would say if you're doing blistering Moxibustion, not so much, but all those things like Moxa on the end of the needle, Moxa stick, cone Moxa, Ontake, they all feel great. Patients kind of welcome that kind of treatment. Say, oh, that's really relaxing. Now, many years ago, I had a Qigong teacher, and Qigong teacher said, surprisingly, he said, Qigong is a very broad term. He was from China. He said it means Qigong. It just means cultivating qi. So it's a bit like you saying drink. And there's all kinds of drinks, aren't there? So there's all kinds of Qigong. So it's just a very, very general term. And I think that the same applies to Moxibustion because if we take drink, for example, we have very specific rules about water. People say, oh, you really should drink 1.5 to 2 liters of water per day, and that's good for you. But we don't say you should drink 1.5 to 2 liters of whiskey a day, because we know that's not good for you. So the rules for drink are different depending on what the drink is. And I think that this is something that is not understood about Moxibustion, is that when we talk about Moxibustion and we talk about rules for Moxibustion, we need to be very specific about the technique, the kind of Moxibustion we're using, because Moxibustion is as generic as drink. And I invite you to consider a number of Moxibustion techniques. So let's talk about a Moxa box first of all. A Moxa box is it's like a wooden box with a wire basket, and you fill it up with Moxa wool, and you set fire to the Moxa wool, and you stick it on someone's back, on someone's tummy, and you let it burn. And at some point, that heat becomes quite intolerable, and you need to move it. You need to migrate it along the back, or pick it up and lift it off, and the skin becomes very red and sweaty. So no one's going to deny that that is a heating technique. And there's another technique in China called big snake Moxibustion, where you layer a layer of ginger and mashed ginger and garlic all along the spine, the whole length of the spine, and then you put various warming Chinese herbs on top of that, and then you put big cones of moxa on top of that, and then you set fire to the whole thing, and it blisters the spine. So you get a line of blisters going down the spine. So no one's going to deny that that's a very heating technique. Though interestingly, they say that you should only apply it in the summer, and they also prescribe it for autoimmune diseases like rheumatoid arthritis. So nevertheless, we're all going to agree that that's a very heating technique. And then there are other techniques like, if you put a cone of Moxa on ginger or you stick Moxa on the end of the needle, then indirect kinds of Moxibustion, then those are quite warming. They feel quite nice. And you put salt on the navel and you put a cone of Moxa on top, that feels very warming. And then you've got another kind of technique, which is the kind of rice grain or half rice grain Moxibustion cones used in Japanese acupuncture. And these are not considered heating in Japanese acupuncture, they're considered stimulating. So can you see that there's a spectrum of Moxibustion techniques? And the rules that we have, which are you must not use Moxibustion for hot conditions, apply very much to those really heating Moxibustion techniques. But for other kinds of Moxibustion techniques, we could say, well, actually, small cone Moxibustion has its own rules and can be used in certain hot conditions. And I'll give you some examples of those as this PowerPoint goes on. There was a Korean acupuncturist called Sung Baek who published a book with Blue Poppy Press, I think in the early 90s. And he gave a very good example. And I think that people in North America will understand this analogy very well. If I talk about central heating, when I talk about central heating in Taiwan, no one understands what I'm talking about. And in Malaysia, there's no such thing because it's never cold. So, but you people who have central heating, you know that you have radiators, and sometimes you just want to adjust the flow. So there's two kind of faucets on the base of the radiator, and you can turn the radiator on or off, or you can adjust the flow through it to make the water flow faster or slower. So needling is a little bit like those valves on the radiator. And then sometimes there's a blockage in the pipe. So then you've got a separate valve, and you've got a radiator key, and you bleed it. You bleed off the air, and then that kind of unblocks it. So bloodletting in acupuncture is a little bit like that. It drains something out of the body. And then sometimes the whole system is low. The whole system is kind of low on water. So you go to the boiler and there's another valve and you open that up and you top it up. You add more water into the system. So Moxibustion adds energy to the body in the same way that sometimes when the overall energy is low, then you start to add something to it. And I think it's because of that sense of adding stuff that's where some of these prohibitions about using Moxa for hot conditions have come from. Because from a herbal point of view, if someone's got a hot condition or a deficiency heat condition, you don't want to use warming herbs. You don't want to add to the heat. But we're adding energy to the body in a very specific way. Oh yeah, sometimes people ask me where Ontake fits into this spectrum of techniques. So those of you who are using Ontake, it's somewhere between warming and stimulating. So I'd like to talk about skin conditions first of all. So skin conditions like eczema and psoriasis, you have these raised red areas on the skin. And that can be seen as a local disturbance of yin and yang. So if you think of a patch of psoriasis, the raised red area is excess. The Japanese word for that is jitsu. And the skin surrounding the lesion, therefore, must be deficient, yin, must be kyo. So there's a balance. If something is excess, then the stuff next to it is deficient. So in Japanese Moxa traditions, we try and supplement the chi flow on the borders of the lesion. And there was a guy called Fukaya Sensei in the 20th century, and he talked very much about doing surround moxa around the borders of the lesion. So here you've got a diagram which shows the raised red patch. Let me see if I can get my laser pointer going. There we go. Yeah, so the patch is raised and red. So this is excess. So therefore, this bit here is considered to be deficient, and out here is normal skin. And if we look at it from the top, here's the raised red area, this is excess. So this area here is deficient, and here is normal skin. So what we want to do is surround Moxa. We can do north, south, west, east. We could just do 4 cones of Moxa around the borders of the lesion. So just around here. So you can use direct Moxa, or you can use Ontake, or you can use a Moxa stick if you like. But Fukaya recommended direct Moxa. So that's an example of a hot condition where you can use Moxa. You can also use it for inflamed joints. So in this case, you don't do it directly on the inflamed joint. So if someone's got arthritic fingers, but you can do it more proximately to the joint. So you can do direct Moxa around the wrist to treat the fingers, or if the inflamed joint is here, you can go more proximal or more distal. So you can certainly use it in hot inflamed joints. I'd like to talk briefly about a guy called Hirata, who was another 20th century practitioner. And he came up with a kind of holistic or traditional East Asian dermatome system of the body. And he divided the body up into regions. And he said each of these regions, like the arm and the leg, can be divided into 12 zones corresponding to the organs of the body. And these regions were the face. And someone's got their microphone switched on. Could you turn off your microphones, please? So the face, the scalp, the head, the neck, the torso, the arms, and the legs. And he used he developed something which was called hot needle therapy. I'd like to repeat that someone's got their microphone on, so please turn your mic off. So he used this stimulation tool. It was called Sanryoki, and it was a small cone filled with burning alcohol, and he would tap that heated tip onto the skin. So there's a diagram of it. And here's a quote from Junji Mitsutani, who's the author of the North American Journal.
You stopped sharing your PowerPoint there, Oran.
I stopped sharing?
Yeah, I don't see the
okay.
PowerPoint anymore.
I see it.
Oh, okay. Where'd it go? Okay.
Right.
Strange.
Yeah, I think maybe it was fading, like the transition between the slides is fading.
Okay, I see it now. Okay,
yeah,
got it.
so Junji tried this ancient device out on himself, and he ended up with these it felt like a brief stinging or sharp sensation, and the next day he had many small burns about 2 millimeters across. So this was a hot device, and of course, you can use Ontake in this kind of thing, or you can use Moxa cones or platform Moxa on the zones. But I'd like to show you the kind of diseases that Hirata was treating. This is just ear, nose, and throat. So you can see tonsillitis, toothache, periodontitis, conjunctivitis, blepharitis. So all hot conditions, which he was treating with his Shinryoki. And then look at these are cardiac conditions: angina pectoris, atherosclerosis, heart disease, myocarditis, endocarditis. So you get the sense of these kind of very hot conditions. So I'm going to stop my share there and take questions. And also, I think Merlin might come in as well with some comments, because, yeah, so Merlin, would you like to add anything to that before we open to questions?
Yeah, well, my understandings is completely coherent with what you're saying, and part of the TCM, let's call it dogma, is probably because of the focus of TCM, the weighting for herbal medicine. And so, and herbal medicine, as I understand it, I'm no expert in herbal medicine, so, but as I understand it, mugwort is at least a warming herb, if not a hot herb. But there's been a debate on this for at least 200 years on whether Moxa is appropriate or not appropriate in
Hmm.
hot conditions, and
Yeah, fighting fire with fire, I guess, in
yeah,
one way.
yeah,
Yeah.
yeah. Which and I mean, what do we do? But if we want to break a fever, we use heavy Moxa on do 14 to, and that's exactly what we're doing, isn't it? It
In
fights the
Japanese
fire.
acupuncture, yes.
Yeah, yeah. So
We have a question that's coming in. Can moxibustion be used for mental illness? And the asker of the question said, for full disclosure, I do Chinese moxibustion.
Mm.
whatever that is, exactly.
Yeah. Okay.
I bet this,
I'll try and answer that. I would say that Fukaya again was a very influential Japanese Moxibustion practitioner, and he came up with a number of points which are referred to as Fukaya's neurogenic points or Fukaya's psychological points or anxiety points. And basically, he used them in all kinds of mental disturbance. So insomnia, anxiety, depression. And these are points along the spine, along the points of the Dumai, between T3 and T9. And he would palpate for tenderness in the intervertebral spaces, and then make a kind of list of which of those were tender. And then he would burn rice grain moxibustion on those points. So in terms of your question, can moxibustion be used? Then rice grain moxibustion is really effective in all kinds of emotional disturbances, including mental disease. So I would say then the answer is yes. Now, whether you can use a moxa stick and Chinese moxibustion in that context, I'm not so sure. And I think that one of the points that Merlin has made with me before is that you need to use the moxibustion technique that is recommended within the culture it's recommended in, or in the context it's recommended in. So if someone says, yes, you can use Fukai's anxiety points for this kind of condition, then that's the kind of moxa you should use. So you shouldn't be using a moxa stick if it's prohibited. So I think that's your point, isn't it, Merlin?
yeah, yeah, absolutely.
Um,
And I think it's very important that,
mm,
yeah. The other thing, just adding on to what you're saying about Fukai's points on the back. Um, so, and this comes back to this idea of multi-mechanisms. Is Junji, if Junji Mitsutani was here, he would be talking about the autonomic nervous system and how the MOX actually promotes a parasympathetic response, which would be helpful for a lot of mental conditions, I would have imagined. Certainly, using this TRP approach, what I would be interested in those introvertibles, those tender introvertible spaces is, okay, I've found out now maybe three or four of them which are sensitive. Those are my target points. Then I might burn a single cone on each and ask the patient if they feel that cone. If they don't feel it, I'm going to use that point specifically for the Moxa because I know that TRPV1 can be implicated in anxiety states.
hmm. We have a question about shingles, and it was from Sarah, and she says, can Ontake be used for shingles, which she is suffering from now?
Okay. I think so, in the same kind of way that I was talking about with skin conditions. First of all, if the lesions are broken, then you need to have a dedicated Ontake because it's going to be very hard to clean or sterilize. So just a dedicated Ontake. But basically, yes, you can go around it. Now, I mean, it shouldn't be the only treatment, but certainly, yes, I think that would be a very good thing to do, to just do the surround, you can't see, do the surrounding area. So if the shingles is on your chest, then to just tap around that, around the lesion. Yeah, I would say
Mm.
so.
I would also add in, since shingles, certainly from my understanding, is it's like a breakout of a dormant of a dormant infection, isn't it? So basically, you want to do anything you can to support the host immune response. So I would definitely also add in at least daily stomach 36 with Moxa.
Hmm.
Mm.
We had somebody ask for you to repeat the name of the source person for the mental emotional disturbance that you said that did the treatment on the back. What was the name again?
Fukaya, Fukaya.
Okay,
And
and
you might be able to find that Fukaya's neurogenic points. You might be able to find that on a internet search.
Tammy is asking, can we accurately say that Moxa will activate the cooling function and heating function of the TRP?
That's the beauty of it. But if they can simultaneously almost do the opposite things, as long as these TRPs are expressed beneath where we're doing the Moxa burn. So if they're not, then if only TRPV1, that's the chili one, the capsicum, is expressed, then you're only going to be able to exploit the heat aspect of it. If TRPM8 is expressed, then you're only going to be able to exploit the cooling aspect of it. And how do we know what is expressed where? That's one for people with on a higher pay grades than me, frankly. But yeah. But the heat response gives you that's our first entry point.
I have another question here from Margaret asking about COVID, exacerbation of COVID vaccinations. So can Moxa therapy used to treat clients whose underlying medical conditions are exacerbated by their COVID vaccinations? Do either of you have an opinion about that?
I jump in on with two answers. We did a study with Moxafrica. We did an exploration study testing four different Moxa protocols for long COVID. Long COVID isn't necessarily vaccine related; it's COVID related, but it's spike protein related. That's for sure. And we honed in on one particular protocol in the end. There's some stuff on the Moxafrica website on that if you want to find it. So, but aside from that, the aspects of complications from COVID vaccine sequelae are so variable that I think you've got to be very cautious what you've got to say. But again, it's about pushing the immune system outwards, I think, to try and expel something out of the body.
So we have Tina asking, oh, it's a direct message, but I think it's a question. So when using Moxa over acupuncture points, does it work better than using it over random spots on the body? Could this be because of the higher concentration for different combinations of your three TRPs for the acupuncture points? In other words, would you say that acupuncture points are seemingly have more concentrated TRPs?
Possibly.
Right. I would say Fukaya had definite principles for selecting where to do Moxa. One of them is he said, then when you palpate, you need to find some kind of induration. So you can't just do Moxa on a random point. It needs to be actually hardness or tightness there. And the second reaction that he said made was his definition of a point that was useful to do Moxa on was that it was slightly painful when you press. So first of all, there has to be pressure pain. Secondly, there has to be a sensation of induration under your finger when you're looking for the point. And then that's his definition. If you find those two things, then that point is going to work. If you don't find those two things, that point's not going to work. Now, that might tie in with TRPs, and we don't know. But what Merlin is now adding to that mix is he's saying, once I find these candidate points, I'm going to test them for heat sensitivity. And the ones that are not sensitive to heat are the ones that are most likely to initiate this kind of cascade of reactions. So I think that might answer your question in a slightly different way.
And And finally, on that one as well, we're not trying to discount channel theory at all, which is, of course, another mechanism. So I don't want anybody to leave today thinking that they're just trying to dump everything traditional about acupuncture or about acumoxa, because we are definitely not doing so.
Yeah, yeah, that's a nice point. I would say that one thing is that you've talked about your protocols a little bit here, and finding these desensitive points. But something that's in the book that is very noticeable is that you talk about how you treated fibromyalgia, and you suggest protocols for different diseases. And you kind of establish a kind of well, this is one thing that you do near the spine, this is what you do on the back, and these are the distal points that you use. So I think that's worth kind of mentioning that that's also in the book, that it's not just people have to make stuff up, but you've already established a protocol. And if people are interested in this, then this is a really good thing to research, because if you start to apply these protocols, you might find that you're getting different results with things like fibromyalgia or kind of chronic intractable diseases.
We'll do one last question here because we've kind of reached our time limit. It's from Laura. She says, when you check a point with Moxa for sensitivity, are you burning the cone directly to the skin and asking the patient for sensitivity, or are you burning 50% of the cone and then looking for sensitivity from there?
Well, for me, I know, roughly speaking, when a patient is going to feel the heat from a small cone. These are rice grain cones. So I know when the heat is about to hit. Now, with some patients, they're generally not so sensitive anyway, and some patients are very sensitive. But it's the difference between different points where it gets really interesting. So basically, I'm going to burn, say, for instance, I've found 5 sensitive, palpably sensitive points, which I'm going to select. I'll burn 1 cone on each one. And as I'm burning each one, just at the point when I expect them to feel it, I snuff the cone out. Did they feel it or did they not feel it? And then I come back to the ones where they say, no, I didn't feel anything. Repeat, repeat, repeat.
Okay, well, great. Well, I'm going to thank you both for sharing your deep insights into Moxa. And thank you all for attending and for your questions. I'm going to just stop recording now, and then I'll just conclude the rest, because the rest will just be more discussion on the book and so on. So.